Welcome to our presentation on the intersections of gender and race among older adults during the COVID-19 pandemic. Part of this presentation was recently presented at the 2021 Gerontological Society of America Annual Conference. Our research examines the experiences of older adults by gender, race, and at the intersections of gender and race during the COVID-19 pandemic. We used data from the 2020 Health and Retirement Study, which included COVID-19 related questions, and we used the descriptive intercategorical analysis framework to analyze the data. During the COVID-19 pandemic, over 70% of older adults engaged in wellness activities like watching TV, reading, using the computer or internet, gardening, walking, baking or cooking, and praying. Over 80% of adults were satisfied with their lives, but more than half of them were concerned for their health, the health of others, and the future. A closer look at the intersections of gender and race show that there are several observed differences. For example, Black women were less likely to work for pay, volunteer, and participate in education and training programs compared to white women, white men, and Black men during the pandemic. Additionally, Black men were reportedly more worried about their own health, the health of others, and their financial situation compared to white women, white men, and Black women. Also, 40% of Black men were more worried about being able to get help if they needed it compared to 27% of white women, 30% of white men, and 30% of Black women. Nonetheless, individuals across all groups reported being satisfied with their lives. In conclusion, our research shows that older adults engaged in a variety of wellness activities and had concerns for their own health, the health of others, and/or the future. We hope that our descriptive findings will initiate a more in-depth review of older adults' lived experiences and identify programs and policies to help older adults adapt to the ongoing challenges of the COVID-19 pandemic. For more details on this work, please see our full-length manuscript, which has been published in the Journal of Applied Gerontology by scanning the QR code. Additionally, you may contact the principal investigator for questions and comments. Funding for this research has been provided by the Sloan Research Network on Aging and Work. The views expressed are solely of the authors and do not represent the Sloan Research Network. Thank you.